This episode of Let's Talk Natural Medicine is brought to you by BioGlan MedLab, proud platinum partners of ATMS. Built on 50 plus years of healthcare experience and nutritional science, BioGlan MedLab delivers practitioner-only formulas, trusted by practitioners, loved by families. Hello, everyone. Welcome to Let's Talk Natural Medicine, the Legend series. I am joined today by Jacqui Fernandez. She's a naturopath, a nutritionist, a psychotherapist with over 20 years experience in the integrative healthcare sector. Jacqui has spent a decade working within a medical centre alongside doctors and allied health professionals, combining personalised nutrition, evidence-based testing, whole person care. I love that. I love holistic practitioners. So today we are going to have a wonderful exploration into Jacqui's journey. Welcome to the program, Jacqui.
Thank you, Annie.
So when someone hears the word integrative care, what does that actually mean for you?
Integrated care is where you meet the patient where the patient is. As therapists, most of us, we have the chronic cases. So an integrated care is to look at what symptoms they're coming with, what are the underlying causes, what is their lifestyle, what is their circumstances, what is their personality. So it is that immersion during your taking your consultation or your case taking that gives you that integrated model. And then you can't just go blah, 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 blah. You would have to do it layer by layer. Are they absorbing? There's no use of prescribing everything when they may not be absorbing.
Exactly.
So it is that journey, immersion with the patient of where the patient is. We could give them everything right, the herbs and everything, but they might have a stressful lifestyle and that's not going to work. You've got to learn to manage it.
Fantastic. Thank you for that. And we are going to come back to where you're at now, but I want to take you back, if that's all right. You began in corporate finance, which is very different, let me say. So how long were you there and what led you to a real massive change of direction to where you ended up?
Annie, mine is all unplanned events. I don't know. It has been unplanned. So I was a financial controller for a multinational company. So we did airports around the world. I told my receptionist, I'm just going to pop out to the school for an interview for my 5-year-old. And I came back and resigned. Asked me to stay home. Yeah, the company went that way. They went, oh my God, what are you doing? I resigned overnight and I never went back to corporate life. I had no idea what I was going to do. Never heard of naturopathy, never heard of natural medicine. And then my husband came home with, those magazines you get in Sydney at the station, they pump it into your face.
Yeah.
IT banker. And on the cover, we had Nature Care College open day. And I opened it and I went, oh my God, look at this. This is totally different lifestyle. Went for the open day, signed up, full-time degree and diploma on the same day. Couldn't pronounce naturopathy on my first day.
I love that, but I do want to tap into what happened at that duck out with the child's meeting moment, because all our listeners are like, what happened when you ducked out and then you came back and you had this moment? So what happened there?
I was sitting with the principal and she was asking my 5-year-old all these questions of getting into school. And I was like, hurry it up, I've got to go, because all our international calls come in late in the evening, like London, Israel, Netherlands. So for me, afternoons are really important. I was like, hurry it up. And then suddenly that lady asked her, now, what would you like, Nikita? And she said, I'd like my mum to stay home full time. Or I'd like my mum at home or something. And I walked out and I rang my husband. He was an IT analyst in Pitt Street. He's a Pitt Street banker. And I said, Nikita asked me to stay home, I'll resign. And he said, yeah, go ahead.
Oh, wow. Well, that's the right husband to have, first of all.
Legend.
But also, so that's interesting. I mean, that's a point of what drives your choices. So obviously, you needed to be led then into the area that you did actually love, but also sometimes it is just that lifestyle, that X factor moment of this is actually, it comes down to values, doesn't it? You valued
I
what.
wasn't a deep thinker, honey. All I was thinking is I am so specialized in international corporate accounting that I can't go and work for Harvey Norman. And I don't think I'd be very good at making cappuccinos. So I was lost. Nothing,
So you
nothing
really just needed
fancy.
that magazine at the train station to say, how about nature care?
I
Give
was
that
like,
a
oh
go.
my gosh, look at this. All I couldn't understand was why they wanted 4 years to teach me herbs in my head was sage coriander.
That's my next question.
And
What surprised you most about then suddenly entering the world of natural medicine? What, that it was so much bigger than you imagined?
it's a totally different language. You know Ian Breakspear, he was my herbal medicine lecturer, and I remember asking him what STD stood for, because in accounting world, STDs are accounting standards.
Mm,
STDs and what's the STDs and will that a thing to Amsterdam or. So we would look at accounting standards at STDs.
mm.
When he said this can treat STDs, I'm like, what is an
What?
STD?
Classic.
It was a journey. It wasn't easy. It's a totally different language.
Mm,
It's like how people may know what a balance sheet is. You've got a vague idea, but
mm,
you don't know what it really is. For me, depression was like that. I had no
mm.
idea what it actually meant. I thought nutrition was all about they're going to give me combinations of potatoes and steak,
Yeah.
recipes. One recipe, and that was for pesto. The rest was, what is B vitamins for? The immersion, I couldn't believe it, and the biochemistry. I'm like, who are these people? What are they going to be doing with this Krebs cycle?
Amazing. But that's it. You need to come out as a clinician who thinks in the nutrients, not on what the plate looks like. Do you know what I mean?
The place
It's
also
the,
was
it's the
very
opposite of
different.
MasterChef.
The place is also different. Don't forget, I come from corporate. So, you see people in suits and blah, blah, blah. And then I came and people were, so free and easy. I loved it.
Fantastic.
Absolutely loved it.
So you spent 4 years then doing something you thought would take a few
Full
weeks,
time.
and full time you became fully qualified. And then in that time you're studying, but you're also at home with your child. And then what made you make the decision to then go into a practice? You didn't think of setting up your own business?
Never,
You just never.
never in a million years did I think I'd have my own clinic. So we were in Sydney at that time. I loved everything about naturopathy. By the timing I was in my fourth year, oh my God, I even knew what organic meant. I didn't know what I remember coming and telling this girl, I bought some organic broccoli and there was a spider in there. And she said, a little bit of protein's not going to kill you, Jacqui. So that was really funny. So I was in Sydney. I wanted to embrace the lifestyle. So we looked at a radius. I wanted acreage. I wanted to live on the land, that whole naturopathy, slow living. So we looked at land. We wanted a lifestyle. So I wanted to live on land, and we just knew we couldn't afford acreage in Sydney. We had to get out.
Mm.
So we looked at Melbourne and we did 100 radius. And Annie, you won't believe this. The clinic I bought, the guy had been advertising for over a year in the business section to sell his clinic.
Yeah.
And to shut his wife up, he placed one ad in the real estate section. I saw
Yeah.
that one ad, rang him and bought the clinic on the spot.
Incredible. Incredible. You certainly have a laws of attraction thing happening or some
Which I've never heard
manifestation.
of.
Some woo-woo thing connecting your little dots because you might not be the kind of chick who connects those dots herself.
It's later on you look back and go, what were you thinking? Now I wouldn't have, I don't think I would have the courage to take such risks, but
Mm, you
I
did
think it
then.
felt right. It felt right. My husband and myself are not risk takers, but that intuition I think we need to work with.
So you bought this practice and then you weren't a solo practitioner. Did it come with that doctor setup, the allied health practitioners, or did you actually go, this is going to really be a great combination if I position myself in this holistic model?
It again, a series of accidents. I don't know if I could say this, but I had a patient who came in with mental health. I'd actually moved I worked in a practice with very small group of other allied professionals and moved in, and I had a practitioner and I had a patient who came in, and I said, oh, I need to take your history. And while I'm sitting there, he gave me his criminal history.
Oh dear.
I'm sitting there and going, oh, wow. And I actually said to him, but why would you break in? And he actually made eye contact and he said, to steal things. And I went, of course, of course.
Haven't you read my bio?
And my
Oh
husband
my
then
goodness.
said, that's it. You're not practicing by yourself at home, blah, blah, blah. And at that time, Primary Health was building the Eureka Medical Center here, and I contacted them. I went and saw it and absolutely hated it. It was like cubicles. There were 24 doctors. And I contacted him and said, look, I don't think I can do it. And he came home to visit me and he said, why not? And I said, I need a window. So he said, I'll give you 2 windows. So I got 2 windows and then I stayed there for the next 20 years, 10 years.
There you go. Lifestyle, safety, security, and a couple of windows. It's not hard to
Does
get
it?
Jacqui happy. It's like,
Yes.
All right. So you created this fantastic practice, really. And you've
Yes.
also worked with DNA testing, blood testing, clinical tools. Why is this personalization sort of part of, why did you get into that aspect of healthcare as well?
The DNA testing, I think people are listening to podcasts or something and they're coming in. Very rarely that people from the clinic itself were asking for DNA, but then people within the clinic would hear about that. We live in Ballarat, so word of mouth is quite strong. And then one person will do a DNA. But the DNA testing, I think, is very good, but we might do functional testing for gut where we're not getting results. It's not a one-off. So I would generally work with a doctor. When I say I work with the doctor, I would educate the patient on why I need these tests. And then the patient would go off to the doctor, get the test, get it to me. And if I'm still not getting results, then I would go into functional testing.
And is functional testing like hair testing, or what does that mean to the listener?
No, I don't generally do microbiomes.
Right.
The
Okay.
microbiome, the gut. Sometimes I've done. It's interesting. I've done the hormone panels. For women where I'm not getting results. But that is after we. It's generally a last resort. It's definitely not a first thing. If we're not getting results, then it gives us an understanding of what is happening internally.
So for you, more it's you do the usual nutrition approach, for example, as according to the way you're trained, and then when that doesn't happen, is probably more of a genetic difference or a gut health problem or something, and then you do the testing to find out how you can personalize your care for that person. Is that right?
Yes, or I'm working everything and it should work. Why isn't it working?
Yes, that's an easier way to say it.
Yeah. How come I'm not getting outcomes? For me, it's all about measurable outcomes. I'm an accountant. I need to know
Yes.
what measurable outcomes is. If you're not getting results, I'm getting frustrated. Not you, but I'm getting frustrated. And, I remember doing one hormone test, and the reason for it is she was exercising excessively and eating a numerous amount of one food.
Wow. Okay.
Once we worked that out, there was no recovery. Once we work that out. So I think it gives us those things that there's no way people say they go to the gym, we might ask them how many days they're going, but we didn't know they were working that many hours with that intensity.
Yeah,
And what were
exactly.
you eating? Do you know what I mean? They suddenly change their diet without telling us. You might do a whole nutrition thing and then you go, what is happening here? So those sort of things I would do. It's more exploration.
Yeah, I love your approach, Jacqui. And coming from that accountant brain, I can see that that must be actually quite refreshing for patients when they actually have their situation explained just really clearly from that results-oriented approach. So sometimes you can get lost in the verbiage, if you like, and go, it sounds all very interesting, but what does it mean? And I think to be able to tell someone that you've got an issue, it's annoying you as well as them, and then this is the way we're going to approach it. I think that would be, yeah. I'm sure you would get people going, oh, finally, very refreshing. And tell me
Yes.
what to
And
do next.
yeah, even with psychotherapy, I think subtle as a sledgehammer.
Oh dear. I come from Russian stock, so I think I've been called the same. Oh dear.
Yeah.
So you spent 10 years in this integrated medical center
Medical
or
center.
possibly more.
Yes.
What did that environment teach you working alongside other practitioners?
I think it gave you confidence. It gave you, I think also I did it earlier, like in the middle of my career. So it gave me confidence, like if I needed something, I could go and talk to a doctor, or if the doctors wanted something, they could come and talk to me. It also, the facility itself was very supportive. So
Mm,
I didn't have any financial stresses of, did I order because I had people. So I always say I'm a really bad receptionist. I'm a good therapist. So all of that was taken away.
mm,
Talking to specialists, you go to the lunchroom and you just have these deep conversations from two different models.
mm. That would be fascinating because, one, to be feeling like you are definitely part of that team, but also that's an area that many solo practitioners would crave. They're not part of an collaborative team. They feel that they're not understood or connected with other health practitioners the way they would want to be.
It is, and I think again, Annie, I think I had a lot of opportunities because when I was a student clinic, I got a clinical hour with an integrated GP, and I remember the lady saying, "Are you training to be a GP?" And I went, "No, but I've got some clinical hours." So even that was, valuable.
Yeah, yeah.
Everything is so valuable.
Oh, I agree. Everything in life is valuable and it's about seizing the opportunities. So, how
Yeah.
did collaborating with doctors, pathology, allied health actually, have you got any examples of how that model gave a better outcome to a patient?
I think patients, when they know you're working with their doctor, gives them a level of confidence in both.
Mm,
Also, the doctors, I would be able to get test results a lot easier. I would discuss why I would need a test result, right? So that was quite collaborative that way. Or a patient or a doctor might come and say, look, these side effects are too much for her, and then we work out why. Is it the liver? It's not just the
mm,
side effects, it's that underlying, which they really loved.
mm. So that works well. Are there any challenges for you in this model?
Busyness. And look, you're not going to get along with all the doctors. I've never had any issue with any of the doctors, but I think a lot more, some are more leaned towards natural therapy, some are not.
Mm,
And also, nobody's going to hold your hand. They're
yeah.
doing their work. You got to do your work, sunshine. That's it.
Mm. Okay, so it's yeah, toughen up, princess. You're just
Yes,
a colleague like everybody else is. We're here
absolutely.
together, here to help if I've got time, but do your own thing.
And I think you have to have that confidence or you will lose that respect.
Yes, yes, because that's how the mainstream medical profession works. They just
Confident.
do their own thing. They're confident. They say, "Oh, I'm trying to do what I do, and therefore I don't have to apologize for it. I don't have to ask permission for it. I just do."
And Annie, that's the way I operated in that integrated model.
Now, your philosophy centers around treating the whole person rather than just isolated symptoms. So, why is that
Yes.
so important? Because so many people, including myself, will go, "Oh, I have a symptom, got a sore shoulder, got an achy something, and I'll go to a practitioner for that." But you don't work that way.
If it's an acute one, yes. If it is a chronic one or it is reoccurring, then I would go through. So I actually, when I was at the Integrated Medical Centre, just for fun, decided to do my master's in psychotherapy and counselling.
As you
Uh,
do.
As you do, yeah. What do you do between those hours? Sometimes when you get up in the middle of the morning, you do your assignments. So I think that has given me, I'm able to tune in better. I can tell when a patient is it the treatment? Is it the treatment? Is it the diet? Is there something else going on here?
Mm. Mm. We all look at wanting long-term health, right? There's got to be factors that you see day in, day out. People's sort of attitude to their lifestyle, environment, their mindset, consistency of exercise or anything. Is it a combination of just do things consistently well, or are there certain patterns that you've noticed over your career that can really help? Easy wins for long-term health.
I think one of our core principles is educate.
Mm.
And when you educate the patient and give that patient, we're just vehicles. At the end of the day, they do the work.
Mm.
And educating them to get to know their body, what are their triggers, what are the foods, how they can challenge. Someone might say, but I love potatoes. And we go, okay, you can eat a potato, but, let's have a potato with, a handful of veggies.
Yeah, they're like, okay, I don't want those.
Let's do the veggies you like, It is about giving them the tools to get to know themselves, to be able to. And when it fails, yes, please do come back. Bring your list. Bring your list.
Is it crazy, Jacqui, that in a first world problem, we're not aware of what actually just makes us healthy? Do you get surprised by that, or do you go, oh no, people get busy or they aren't educated properly? So it seems pretty crazy. We've got so much information, but it's not applied.
Yeah, I think it's the noise. It's the noise. People bring bags of stuff which they've bought, because they've listened to someone or whatever. And we go, for your conditions, that's not great for you. Magnesium oxide is not the best, really. It might be cheaper or something. So it is a noise. People are listening to that. I think with the volume of information are coming in, people are getting lost. Or they're trying, tripping up, getting disillusioned. And then when they come back to basics and understand, you can feel that pressure coming down.
What is more common? People neglecting their own wellness, their self-health, or is it that they just, we're doom scrolling on Instagram and we buy every little tablet or go into a supermarket and just self-prescribe or, go to Dr. Google? Is it just too much stuff that we're putting into our bodies, or is it more that we just don't stop and we're too busy and neglect ourselves?
Yeah. Look, in our clinic, we do get people who are either business people or working people, right? They are busy. So they're looking for easy. People they're busy, they're looking for easy, and they will listen to anyone who they think is giving them information.
Yeah.
They may not have time to listen to podcasts or something, but if their girlfriend said, oh, you want to listen to this podcast and I got this or I got that information, then they take that as gospel, try it, and then it doesn't work. Or they've tried something and they are sick of being sick.
Yeah. Yeah. Now, you have stayed in practice in the one regional city for over 20 years, which is amazing.
Yes.
So it's great. It's like, what a testimony to your professional skills and your ability to have that successful business. What does that require to become that person, that tried and tested person?
I think, first of all, people don't care who they're seeing. It's outcomes.
Yeah, good advice.
It's outcomes. It's absolutely outcomes, right? They want something that works. And I think when you get outcomes in a small town like ours, then you build up a reputation or a word of mouth. That is one. Even though I love COVID, didn't we all love COVID? I escaped to my home, but I still maintain my presence, knowing there is brick and mortar there. Even though I'm not there, my products, people come and pick up my products from the place I was working with, my suppliers drop off products. I think also people know that brick and mortar, she is just down the road.
Yes. Yes.
You know what I mean? I know she is somewhere in Ballarat, even though I'm outside of Ballarat. I think all of those give, and again, I think it's the outcome, the results the patients get.
And that's what it should be. That's business 101, isn't it? That stop telling people what you do and start telling them, that they've got a problem and you could have the answer for them, and what that answer is, and being very clear in the language. So,
Yes.
and I think it's great in a regional city. There's positives and negatives of that, isn't there? It's like when people love you, they really love you, and you get mass referrals. But you can do one thing wrong, and suddenly word spreads, and it can be a negative. So I think you've been doing a very, very great job out there somewhere near Ballarat. So
Yes.
how has public perception changed about natural medicine over your career? It must have done a massive shift over time.
I've run a few events in Ballarat. Like I've done the Heal documentary. I brought the Heal documentary to Ballarat. We've done a natural medicine one. We've done Jean Hales.
Yeah.
We've done those. And I can tell you the response has been, we've always sold out within a week, under a week.
Wow. Always.
Always. I mean, obviously we didn't run multiple events, but the events I ran sold out with under a week.
So there's always been interest in your area.
There seems to be. And I think because we're so busy in clinic, we don't feel the pulse.
Yeah.
We don't know what is happening. Or people will say, you go to the post office and, you go, hi. And then they look at it and they go, oh, you're Jacqui Fernandez. My husband comes and sees you. Oh.
Yeah. You're like,
do you know what I mean?
Yeah.
Those sort of things in a small town you get. But I think, Annie, sometimes we're busy. We don't stop as much to reflect as such. We also build stronger connections, I think. With people who are around us. It's been great.
Fantastic. What has kept you grounded and practicing for so long? Like backing it up and still having this freshness and vibrancy that you have. I can feel it today. You love what you do, which is just so rewarding. But what has kept you grounded? There must have been challenging times, or did you go, no, I've actually just been in my happy place for 20 years?
No, definitely no. There've been a lot of challenges. I think it is patient outcomes. It just, I always tell people, people might love what they do, or when you're doing whatever it either lifts you or drops you. Whatever you're doing. Mine certainly lifts me. There's a lot of swearing going on in the background, but at the end of the day, I think the patience, that give and take that has kept me here.
So you look back over 20 years, and is that what you're most proud of? Just the results, or how would you describe what you're proud of when you think about your journey?
I think I'm very grateful for a lot of opportunities that I got. I'm very grateful for some of the risks I took, but I also am very grateful for the people who came for my services and got the results that I delivered.
It's a great legacy to leave one day.
I hope so.
So what advice would you give practitioners who are thinking, oh, yeah, I thought I'd become a solo practitioner, but now I'm thinking, I've listened to Jacqui, I could build a really respectable, sustainable practice with other practitioners. Would you say, is it for everybody? Is it for some? What would your advice be to them?
I think you need to have a strong backing. I had my husband. That gave me confidence. I think you need to have some resources. You also need to have a passion. I love herbal medicine. It's in the blending. It is, in cooking, it's the stirring. In herbal medicine, it is a blending. It is the blending. And if you've got that passion, when I was a student, you know how we have the theoretical framework, use 5 herbs or 6 herbs. And I think I struggled with that. I really struggled with that. And when I was in student clinic, I don't remember this lady's name, but I remember her face. She had curly hair, one of the supervisors. And she came and she said, use your theoretical background, but you have to do what the patient needs and your intuition. You know your herbs. You know your herbs. For me, and that was a free pass. I was out the door. I can have 15 herbs in one of my formulas. Depends on what the patient needs.
Yeah. So the listener today, just to finish up, if they're feeling that things haven't been working in their health, they're feeling that, you know, what they've done hasn't worked, they've wondered, well, should I go to an integrative healthcare practitioner? I don't even know what herbs are. You know, what's your advice to them? What should their next point be? Explore. What should they explore?
I think they should explore that therapeutic alliance. Does it align for me? Does that person align for me? Does that career align with me? That therapeutic. We're in a therapeutic. We're not dishing out, you know, something. We are treating people. They're ingesting it. Right? So I think we need to turn that noise down. There's a lot of noise.
Yeah.
And look at your own individual circumstances. Look at your own individual needs. And then make decisions.
There you go.
Listen to your heart.
Thank you so much, Jacqui, for sharing your wisdom with us today. Thank you to our listeners. So great to have you joining us again. If you are thinking, you know, I need to get a bit more focused, and drop onto atms.com.au or just scan the QR code if you're watching us. And we'd love you to join Friends of Natural Medicine. So click on Friends. When you join Friends, it's free. You'll just get an email every 2 weeks into your inbox. It will give you a recipe from one of our celebrity chefs or nutritionists. You will also get a blog written by a accredited practitioner. You'll get links to podcasts like this one, and also so much more. So we would love to have you join our community, atms.com.au. Click on Friends. And finishing today, thank you so much for being on the show today, Jacqui.
Thank you, Annie. And all the best.
Great having you join us. Talk soon.